all about narratives, and this word gets bounced around a lot, and there's a lot of different narratives that are written. What is a narrative in the particular scope of a CSR or a CTR? And when do we write them? Why do we write them? How do we end up with large numbers of them? And what happens if we have to write 200 narratives?
I can kick off with the CSR, or as now known, CTR narratives. They tend to be a patient-focused narrative rather than an event-focused narrative. So our pharmacovigilance colleagues will write event narratives. They do not get published, those narratives. So when we write our narratives, we make sure that they're as anonymized as possible so that the patient, subject, participant cannot be identified from them. They are done, as I say, on a patient basis, and they are based on the final TFLs. So the data doesn't come from CM's forms. Best practice is to rewrite these narratives from scratch, from the tables, listings, and figures that are produced after database lock.
And so just to clarify, Jules, because I think that's a great point, if a patient has 4 serious adverse events in a trial, our PV colleagues are writing 4 narratives because it's 4 events. Whereas in the clinical study report or clinical trial report, you're going to have 1 narrative for that patient that's going to condense kind of their journey and what happened to them during the trial.
It's storytelling to the utmost degree for medical writers. It is from when they joined the trial to when they left the trial, and what their purpose, what their journey took with the SAEs or AEs leading to withdrawal, and unfortunately, obviously, with deaths as well.
And it's really important, and at the beginning of a trial, and this is where we really need the support of our biometrics colleagues, to think about, is this a trial that's going to have 0 or 1 narratives? I work in a lot of early phase stuff, that's very often the case. Or is it late phase, huge trial that's going to have 200, 300 narratives? And if the latter is the case, then we really need to think about some programming applications to that, because of course I can write a single narrative from patient from the TFLs that come out from the CSR, but I can do that for 200, but it's going to be very, very hard.